All right, so I think we'll get started. I want to welcome everyone to today's webinar. It is broadcasted by Dr. Slava Kim, who is the Clinical Director here at Meditech in Toronto at our BioFlex Therapy clinics, and I'll hand the wand over to Slava.
Thank you, David. Good afternoon, everyone. So we'll talk today about the wound care and wound healing with the use of laser therapy. So let me just close this. I can click on this one, right? Yeah. Thank you. So how big of a problem is it, the wound care in general? Not to waste any time, I will just present these numbers that I was able to collect over the course of a couple of years in the past, going through various sources of literature and statistics available about wounds. And you can see the numbers in regards to the situation in Canada as well as in the United States. Not to mention the cost involved in the wound care per patient. And obviously it's quite an expensive burden for the healthcare system. One of the reasons why we see more and more cases of non-healing open infected wounds is because of the epidemic of diabetes. As you can see, in the year of 2000, on a global basis, there were an estimated 151 million people suffering from diabetes. And then we see how numbers are growing. So 2011, as you can see, just within 11 years, numbers have doubled. And by 2030, we expect 552 million people globally suffering from diabetes. And as you can see, 183 million people are even unaware that they have diabetes. So this is the data from International Diabetes Federation. 40 to 70% of all lower extremity amputations are related to diabetes. And obviously at the final phase, when patients develop those non-healing open infected lesions, setting into the gangrenous, pre-gangrenous phases, developing vascular complications as well. And 85% of all those diabetes-related amputations preceded by foot ulcers. So technically, when you look at the numbers, it's quite shocking. Every 30 seconds, a lower limb is lost to amputation. Economical impact of wound healing. This is the study that was done by Dr. Woodbury at the University of Western Ontario Medical School, and a few interesting findings, as you can see. The breakdown is as follows. 25% of lesions were found in acute care hospitals, 30% in nursing homes, 22% in mixed facilities, and 15% under the auspices of community care. Now, take a look at the cost of average treatment. So it would be somewhere close to $24,000, sometimes $27,000, when more specialists would be involved in the care of a patient. And some data indicates that the annual cost of wound care would be close to $60,000 a year per patient per wound. In addition to that, 60,000 Canadians at any time have chronic bed sores or pressure ulcers. $22.9 billion in total expenditures annually, and $1.8 billion in out-of-pocket costs. So we're looking at the data I have gathered from American Association of Clinical Endocrinologists. And here's a massive number of $57.1 billion on both diabetes and its complications related. So the diabetic foot care accounts for up to 20% of total healthcare resources available for diabetes, and the estimated cost of diabetic foot ulcer in the United States would be $7,000 to $10,000 when amputation is required. So obviously, because of the cost of surgical procedure, it goes up to $65,000 US. So in Canada, roughly, it's going to be somewhere between 27 up to 100,000 Canadian dollars annually. So here's the good news. 49 up to 85% of all of the amputations can be prevented. So how can we do that? By technically eliminating contributing factors and finding simple but effective solutions to the wound care. So dimensions of the wound increase, technically they grow in the periphery if there is the oxygenation compromise and antibiotics perhaps are not inadequate. So another thing, speaking of antibiotics, two well-known side effects of antibiotic therapy, especially when utilized for a prolonged period of time, they do suppress immune system and they slow down cellular proliferation, therefore slowing down or sometimes even preventing the wound to heal completely. Then excessive irritation and moisture may macerate cells, making them more vulnerable to further infection invasion, and other impediments such as malnutrition, immune deficiency, obesity, lack of mobility, some other issues related to the individual's lifestyle like smoking, alcohol, and so on and so forth. So those are the phases of the wound healing, not the phases, but the factors of the wound healing that may contribute and trigger those particular lesions, such as atherosclerosis, as an example of peripheral vascular disease, systemic diseases, diabetes have been mentioned, contact ulcers. So there would be some systemic, vascular, and mechanical, as well as infectious contributors to triggering and maintaining those non-healing lesions. For that reason, if we will know exactly what's causing those particular lesions and what is actually is impediment, 25% of wounds can be healed spontaneously when all of the negative factors can be excluded or eliminated. So that's another good point about wound care itself. So let's take a look under that dressing, packing. What exactly is happening when, let's say, we see at our facility patients with non-healing lesions for the first time? The moment I would just lift up that dressing, so underneath we'll see obviously that particular lesion, the defect in the skin, and 5 ideal factors for bacterial contamination and further growth, which means there is no light, there is no oxygen or air, it's moist, yes, underneath, it's very nice and warm, and there are plenty of nutrients in the form of debris, necrotic tissues, discharge from the wound like pus, and this is something that bacteria loves tremendously. So all of those 5 factors will be actually contributing to the bacterial contamination and further existence of that lesion. And conventional therapeutic approaches. As you can see, there are 9 points. This is something that pretty much every wound care clinic would be doing, following doctor's guidelines. And if all of that would be working effectively, then we would not see those patients at our doorsteps. The wound healing with the use of laser stimulation has been well researched. I would say this is one of the most researched fields in the field of laser medicine in general. Since early days of 1963, when Professor Andrea Messer has discovered healing properties of low-intensity laser. Like in this study, without getting into the details, 22 healthy individuals have been studied. So the lesions have been aggravated, and the laser stimulation was applied with a dosage of 8 joules per centimeter squared for a couple of minutes only and 5 seconds, demonstrating wonderful outcomes in terms of healing and tissue regeneration. In other study, placebo-controlled study, double-blind controlled study, 9 patients included with the underlying venous pathology, venous stasis, and ulcers that haven't been healed for a while. 3 treatments a week for 10 weeks, minimal dosage applied, 4 joules per centimeter squared, and the average wound area was significantly reduced in the laser group compared to the placebo group. Here is a meta-analysis that was put together by Professor Chukuk and Wimiker, who is coincidentally is co-editor-in-chief of Photomedicine and Laser Surgery Journal. So he has looked at a few of those studies, like 34 peer-reviewed papers to determine the overall treatment effects of laser therapy. And his findings were that no matter what dosage you will be using, and unfortunately there is a variety of recommended dosages and findings throughout those studies, laser works very nicely. I'm showing you this picture of a cover page of Wound Care in Canada. And as you can see, it was published earlier this year in the spring of 2015. And here is it says, Kickstart Stalled Wounds, a look at laser therapy. So if you'll have the access to Wound Care Canada or the website, you will read a nicely written article about wound healing with the use of laser therapy. Specifically, they'll be talking about our modality, our technology, and the clinical outcomes at Meditech International. Conclusions. At this point, we can say with full confidence that laser therapy has been found to be highly effective in the process of tissue repair and wound healing at the molecular, cellular, and systemic levels. So there may be wide variation in the parameters utilized, dosage, number of treatments, and treatment frequency, but further research and experience will upgrade the protocols required in this process. So the physiology of wound healing, there are 4 main stages of the wound healing. Most of you, based on your personal perhaps experience in wound healing and tissue repair kind of business, you're familiar. Inflammatory phase, a proliferate phase, epithelialization, remodeling phase. And the reason why wounds do not heal at certain stage, they stall, it would be somewhere between the second and third phase of this wound healing. So this is how chronologically the wound healing would look like. You see, from the beginning, from the very first moment when there will be a certain defect or damage to the tissues, which will be in duration just a matter of few seconds or minutes sometimes, and then it goes through the coagulation, and then in phases of inflammation, and somewhere later on, in a matter of few days and weeks, then we observe that clinical physiological stalling. So we would see our patients at the phase of maturation and remodeling that wouldn't move forward. So the effects of laser therapy, as most of you are already familiar with the fundamentals of the laser stimulation and mechanisms behind, so you know that laser helps us to accelerate phases of inflammation, pushing tissues further and closer to the final phase of cellular proliferation, tissue repair, and regeneration. So this will include angiogenesis, collagen production, and remodeling of tissues. So a quick summary of the effects of laser on wound healing. As you can see, it increases epithelialization, reestablishment of arterial, venous, and lymphatic microcirculation, reduction in edema. Obviously, pain will be resolved as a result of it. ATP, RNA, and DNA synthesis, granulation, tissue increase, etc., etc., etc. So this is just the demonstration and visual demonstration of the effects of laser when we apply it over soft tissues, over non-healing lesions, angiogenesis, neovascularization, collagen production as a framework for new tissues to be formed in the treated zone, reduction of inflammation and edema, nerve regeneration. It is extremely important, especially in patients with diabetes and diabetic neuropathies, because on the top of wound healing that will be happening, those patients will notice the improvement in terms of sensation as well as motor function in their lower extremities. And when it comes to the gangrene situation, yes, we can also stimulate bone tissue and reverse to a certain degree if there is some life activity left in these cells. So our strategy is quite simple. Daily visual inspection, elevate the limb as much of the time as possible to avoid any stagnation, any stasis in the lower extremities, leave the ulcer open to the atmosphere, oxygen exposure, relieve the wounds from any pressure and irritation. So that will be including dressings, packing, protective devices, frames, because we see all sorts of devices that patients would be utilizing on the recommendation of previously seen healthcare practitioners. We always encourage our patients to step away from any pharmaceuticals, locally in particular, because that creates this kind of breeding soil for bacteria, especially non-medical ingredients of those topical creams and lotions. And then applying laser therapy strictly, directly over the affected area. In the beginning, we suggest treating aggressively on a daily basis, just to give that initial boost to the cells. And then we space out those treatments down to 3 times a week, twice a week when necessary, and then the final phase of the healing down to once a week. So this is how the actual wound care is done. Most of this will be as part of the homework for patients. And as you can see, the cost of that wound care would be $4.27 when you put together all of those simple elements of wound care. So we suggest our patients to compress the wound as much of the time as possible using the warm saline solution for bactericidal purposes and passive debridement to remove all of the dead tissue from the area, as well as very gently touching in a diluted concentration with hydrogen peroxide. So in critical and extreme conditions where there is obvious ischemia observed in tissues, we suggest utilization of hyperbaric oxygenation. And if patient requires continuous treatments, or the laser clinic is located quite far away from where patient would be, then we suggest using the portable home unit. In that case, considering, let's say, weather conditions, if it's winter time, icy road, snowstorm, patients would have a chance to continue with wound healing utilizing this portable device. Some of you, if you haven't seen it yet, we do have a portable home unit utilizing just two types of arrays, red light and infrared light. So classification of wounds, it's very simplified classification. So wounds that will be aggravated by peripheral arterial occlusive disease, trauma, burns, venous problems, decubitus ulcers, and other types of ulcers. So I'm going to show you a few cases that have been part of our clinical study that we have conducted at Meditech International. Like in this case, it was a thermal burn to the left ankle. And you see initial pictures with measurements of the surface area affected. And then later on, intermediate pictures showing us the healing process. So the final picture after 7 treatments shows us that there was a significant reduction in the size as well as the quality of tissues around the lesion. 32-year-old police officer, as a result of a motorcycle accident and the fracture in the ankle, underwent a surgery. So there was some hardware installed in the form of a titanium plate with few screws, and then post-surgical complication, infection. The hardware has been removed, and then this open non-healing lesion with a high risk of osteomyelitis development. So after a few months of conventional wound care without succeeding or gaining anything, he's been introduced to laser therapy. And as you can see, healing has been achieved completely. 41-year-old with a chronic dermal ulceration, again in the ankle area over the lateral aspect. So he's been suffering almost on an annual basis for a few months. Again, stalling at that particular phase where it just doesn't go anywhere further. So we're able to boost that cellular proliferation, improve the blood circulation, as you can see by looking at the surrounding tissues in the ankle area, and lesion has been healed completely. 90-year-old female patient with quite severe vascular issues in the lower extremities of atherosclerotic nature, in addition to pancreatitis, venous stasis. She has developed quite a few ischemic issues resulting in open, non-healing infected lesions. And she's been told that in a matter of following few weeks, once there will be a demarcation line determined, she would lose the extremity to amputation. So we were able to improve the blood circulation tremendously. As you can see on this picture on your right, the color demonstrating the foot became warm to the touch, and that is why it helped us to achieve the regeneration, tissue repair, and eventually full recovery and healing. 50-year-old female who was also at risk of losing her leg to amputation. After a few months of unsuccessful wound care, traditional conventional wound care, she's been told that there is a bone exposure, there is dry gangrene, and compromised blood circulation in the rest of her toes. So she decided to try something different, which is laser therapy. And we've managed to heal the lesion and to salvage the extremity from amputation. These, again, an example of a post-surgical infection complication as a result of calcaneal fracture, and then the surgery, osteosynthesis with quite a few screws and plates in the calcaneal region. And again, there was a risk of developing osteomyelitis. If you'll take a look at the picture on your left, at the very bottom of this lesion, you might see even the surface of that titanium plate. So over the course of 3 months, we're able to heal completely this non-healing lesion and resolve the situation with infection. 62-year-old female suffering from diabetes. Eventually she developed severe vascular complications in the lower extremity, and as a result of ischemic changes, this open, non-healing, and non-responding to conventional wound care lesion in the calcaneal region. She refused to even entertain the idea of amputating the extremity, and we've managed to help her tremendously, healing the lesion and saving the leg from amputation. Here's the case of a 74-year-old female patient with a severe case of peripheral arterial occlusive disease. She was a candidate for a bypass surgery, and after the initial consultation, vascular surgeon concluded, we cannot operate on you if you have these open infected lesions, because this may result in more serious complications affecting your general health and perhaps even life. So come back and we'll schedule for a surgery once those wounds will be healed, but wounds would not heal because of the compromised proteus supply. So that was like a vicious circle. So you see initial pictures, and this is a zoom in kind of close-up picture, and you see dynamic changes in healing and regeneration. Perhaps you can also pay attention to the enhanced blood circulation in that treated zone. This is the same patient, the same extremity. We're looking at the medial compartment of the extremity, and you see how the size of the surface area is diminishing. So what we've done for patients of that kind, utilizing clinical photography and measurements, we put together those kind of graphs showing us changes in three-dimensional perspective: the width, the length, and the depth of those lesions. And as you can see, with the number of treatments, there is a significant decrease in the size in every parameter of that lesion. So all of those 8 patients that we have discussed earlier today, we put together certain summary in terms of visual analog scale when it comes to pain, wound area, utilizing the clinical photography so that we could look at the rate of their healing. And this is the equipment that we've utilized: red infrared arrays, large surface arrays, and then 2 laser probes, red and infrared as well. So this is an example how this kind of patient would be treated on a bed with extremities straight and elevated, preferably slightly high above the shoulder level. So it's the same female patient I was talking about earlier. Another patient with a diabetic ulcer in a sitting position. That's when the treatment array is applied on the top, and you can pay attention to the plastic sleeve, disposable plastic sleeves that we use to protect the wound and also the equipment from contamination. And this is how we utilize the laser probe. You're looking at my hand holding red laser probe, just a few millimeters away from the surface of the lesion so that we would not touch directly that lesion. And I'm using my own finger to activate the laser probe on the nose cone. So this is just a quick summary discussing the rate of the healing, as you can see, over the course of 1, 2, 3, 4 months, how the size of the area treated with a laser was decreasing drastically. At the same time, with more treatments and observing that healing rate, we have noticed that pain is also going down. So more treatments patients would have, less pain there will be. So it's a win-win situation in that sense. So this is the visual analog scale, reduction of pain. Conditions secondary to vascular complications, just very quickly because we don't have much time left, I will show you and quickly discuss those cases. RSD, reflex sympathetic dystrophy lesion in a 51-year-old chronic smoker, female patient, very painful pathology, and after being seen by a surgeon who suggested to have some surgical procedures done, it would be literally a disaster, because what would happen? There would be more pain, and infection would penetrate into deeper layers of tissues, so surgery would not be a solution. And by looking at the final picture, you can see that the blood circulation much better, lesions have been healed completely, and overall patients recovered tremendously well. 72-year-old male, as a result of venous stasis in the left lower extremity, aggravated lesion over the medial aspect of the first metatarsal joint, very inconvenient area to treat because of ongoing friction and mechanical irritation. With every step that patient makes, there is a certain degree of disturbance to those tissues. But still, the blood circulation has improved and the lesion itself has been healed completely. The unfortunate case of side effects coming from gout medications. This patient initially was prescribed gout medications and then developed this peripheral arterial occlusive disease, gangrene, dry gangrene. So we've managed saving his toes, most of his toes, from amputation, but unfortunately the distal phalange of the second toe had to be amputated because it was already way too far gone. Dermal ulcer, again, a low extremity secondary to peripheral vascular occlusive disease. When it comes to these type of scenarios, you have to keep in mind it's not just the lesion itself that should be treated, but also treating the extremity to improve the blood circulation circumferentially. That's the key to the healing, to the eventually complete healing when it comes to lower extremities. And 88-year-old man with this non-healing diabetic ulcer that was sitting there for 8 months, he's been treated exactly in the same fashion, treating the lesion itself and extremity below the knee joint area. Another case of diabetes, as you can see on the picture on the left, definitely developing the gangrenous toe, great toe, as well as compromised blood circulation in the rest of his toes. And picture on the right demonstrates that blood circulation is definitely much better. There is a revival of those tissues in the great toe area, and eventually the patient was discharged from our care to continue with his home unit applications. Lacerated infected wound with hematoma in 86-year-old female patient with Charcot disease. Very challenging patients to deal with. Nevertheless, she responded very well to the laser stimulation, and that lesion was healed completely. And then I've had this quite unusual kind of case, 21-year-old male with pilonidal cyst and severe draining sinus, and he's been suffering for months and months from this non-healing, infected, constantly irritated lesion in a very uncomfortable anatomical area, as you can imagine. So there was a certain degree of frustration and shame and psychological trauma, so to speak. So we have explained the approach. I have trained this patient what needs to be done at home in a simple fashion, and with a laser stimulation, it's been healed completely. So another case of non-healing lesion in the trunk area would be bed sore, compression ulcer. A very unfortunate case of a 70-year-old female who was severely struck by MS, and she was spending a lot of time in bed, obviously. And after a few months of conventional wound care without gaining anything, we have trained the husband actually to apply a home unit effectively and following our wound care guidelines. So it's been healed completely, as you can see. 80-year-old female patient with a diabetic ulcer and obviously peripheral arteriocclusive disease, diabetic neuropathy, and so on and so forth. Picture on the right demonstrates complete resolution of all of those issues. Again, the approach should be treating locally and circumferentially the extremity itself. 90-year-old male with hemochromatosis. He's been suffering from this condition for many years, and at some point he has developed also arteriocclusive disease in lower extremities. We're looking at his heels from the back. After 2 years of conventional wound care, those lesions would not heal at all. And actually, the very first picture, if you will take a look at the heel on the right-hand side, you will see even a piece of gauze being stuck in that wound. And then you see the progression, the healing, and the final picture demonstrate full recovery. Another case of wound healing, lower extremities, as a result of trauma, crushing injury with certain degree of ischemia, and you see how badly the great toe was injured. And you see the final picture of complete recovery and healing. Thermal burn, the sole of a foot. Again, it is difficult to treat and to heal those areas because patients have to walk, they have to step on that area. It's a weight-bearing segment of the body. So it is always difficult to prevent any further mechanical irritation and trauma. Nevertheless, patient was healed nicely. And look at this case, literally the foot has exploded. This patient was actually treated in Pakistan using our technology and following our wound care approach. And as you can imagine, without any use of antibiotics or fancy dressings, packing, even in those circumstances, this disastrous wound was healed nicely and beautifully. Just one comment about treating those vascular conditions. We always combine laser stimulation of lesions locally with lumbosacral stimulation. Why is that? It's a sympathectomy effect that allows us to dilate blood vessels in the periphery, down below in lower extremities. And this is how we do it. Those of you who are familiar with our low back treatment approach, this is how it's done. So the identification of the lumbosacral area, so technically it's from L1 down to S1, placements, horizontal, oblique placements, vertical position, and then utilization of 2 laser probes over the lumbosacral region. Conclusions. Definitely laser works. for wound healing in particular. And I have to tell you that stimulating soft tissues in general, it is a very easy thing to do. Easy to access, easy to saturate, easy to deliver a stimulatory dosage to those cells that are suffering from energy deprivation, if I may say so. And we can significantly decrease the cost of wound care. As you can see, it's quite simple to follow. We can save a lot of money to the healthcare system in general. So my conclusion is quite simple. If some of those patients, desperate patients, will be knocking on your doors and you do have laser equipment at your disposal, you should definitely try, at least try, helping those patients. Thank you very much.
Thank you very much, Dr. Kim. There may be a few questions here, so I'm just going to take a look. If you have any questions, you can type them in right now, and I'm just going to pull this out. So right now, actually, I don't see any questions. So if you do have any further questions regarding this webinar, you can certainly email us here at BioFlex. You can send them to david@bioflexlaser.com, and I can forward those to Slava Kim. Thank you very much, Dr. Kim. I appreciate your time today, and hopefully everyone enjoyed today's webinar. We'll talk to you soon.